COVID-19 is just a fraction of what these hospitals are doing every day. And they're treating people for all types of ailments, and they're doing a good job doing it. I think that, the concern I have when I see things and people somehow think that, there's not capacity throughout the state is we don't want people who have other conditions other than COVID in particular to be deterred from seeking medical care. We know that happened in March and April, where a lot of people with heart and stroke were deterred from going to the emergency department. You saw significant declines across the country of people deferring care. Part of that was, I think, a fear of acquiring COVID while in the hospital, which is not a good fear because these folks are taking huge precautions to keep everyone safe. But then I think part of it was people just assumed there was no capacity for people other than COVID, which is absolutely not true.
They've all been covered. So let me just suffice to say that I've been blessed to be here.
We're going to get through this. If you look at the data, I know people focus on the cases, and that's something that is an issue. But you look at the COVID-like illness ED visits. We had 2,500 on July 7th. The last 2 days, we've had about 1,000 statewide, and so that's a very significant indicator about who's actually going to the EDs. And so I think, and then we've seen obviously the hospital censuses really stabilize in most parts of the state. Some of them have even declined, which is a good sign as well. So I think that we're going to get through it. I think we are on the right course. I think we will continue to see improvements. We just got to continue to keep doing, particularly the Floridians who are just doing the basic things that really make a difference. We appreciate what you're doing. So